Greetings, everyone. My name's Tim DeTero, and we're here today to talk about uh, anti-arrhythmics. Okay, anti-arrhythmics are the medication that they give to help arrhythmias in the heart, and depending on what's causing the arrhythmia, will depend on what type of anti-arrhythmic that we give. To start off with, it's very important to understand how the heart works, just a few basic points to understand how the antiarrhythmic drugs work. We start off with the conduction system, which the electrical impulses start in the AV node, okay, travel down through the atrium, AV junction, and Purkinje fibers, which is the pacemaker of the heart, and normally fires between 60 and 100 beats per minute. And the heart also works when it contracts with what we call a sodium-potassium pump. Okay, this is important because some of your antiarrhythmic drugs act on the sodium, some act on potassium, and some act on calcium. Okay, the first antiarrhythmic we'll talk about is what we call a class 1. There are several classes. We have a class 1 antiarrhythmic, and class 1 antiarrhythmics act by blocking sodium channels or blocking Na channels. Then we have a class 1A, which are these type of drugs. We have procainamide, which works on AV, junctional, ventricular, and tachyarrhythmias. Okay, then we have a class 1B drug, which the most common is lidocaine. And I'm sure that we've all heard of lidocaine. Now, this is for ventricular arrhythmias, okay? Lidocaine kind of blocks the sodium channels and kind of numbs the ventricles of the heart to help these arrhythmias. Adverse effects of lidocaine include drowsiness, slurred speech, confusion, and of course can cause convulsions. All of these antiarrhythmics have got some side effects, some worse than others, and you'll see as we go along. Now we have class 2 antiarrhythmic drugs, and these are what you're known as your beta blocking agonist or B-adrenergic agonists, or your beta blockers. Okay, they decrease heart rate and they decrease contractility. Okay, thereby helping control the arrhythmia. They're used for tachyarrhythmias caused by increased sympathetic, and they're also used for A-flutter and AFib, increased sympathetic stimulation. The most common beta blocker that you've probably all heard of is metoprolol. Okay, a lot of people take metoprolol, and that's actually the most common beta blocker. Well, let's move on to class 3 antiarrhythmic drugs, and we're just kind of hitting the highlights of them. You could actually have a presentation on each individual drug itself. But class 3 antiarrhythmic drugs are interesting, okay? They block potassium channels, or better known as potassium channel blockers, and they diminish the outward potassium current during repolarization of cardiac cells. So during the repolarization phase, it's blocking the potassium from coming in and repolarizing the cardiac cells. Now, class 3 antiarrhythmics can have a lot of side effects, okay? That's why class 3 antiarrhythmics, such as amiodarone and sotalol, these are usually started in the hospital, okay? Your cardiologist will put you in the hospital to start you on sotalol to watch for the side effects. The most common side effects of sotalol is bradycardia, okay? And they also have to watch for QT elongation. And I have a little paper here with an example of QT elongation. You see this right here? I don't know how you can see it, but there's a QRS, and There's the T wave. Look how long it is between the Q wave and the beginning of the T wave. That's QT elongation. If it begins getting too long, then you can go into VTAC. So sotalol has to be started in the hospital. There's another class 3 antiarrhythmic. It's called dofetilide, and this is used as a first-line agent in patients with persistent atrial fibrillation. Now, this medication, the side effects can cause proarrhythmias, and this is limited to use in the inpatient setting, okay? This is only used in the hospital. I do have some personal experience with sotalol. I was put in the hospital. I was started on sotalol, okay, and the dose has got to be regulated really close. They usually start at the lowest dose, and then they work up if they need to. Once they get your dose set and they watch you for side effects, then they'll discharge you home. Now, if you have any change in the dose, okay, let's say you need to increase the dose, you need to go in the hospital to increase the dose of sotalol because it increases these chances of side effects. Okay, if you stop it and then you start it again, okay, you also need to go in the hospital. So it is a pretty rough drug as far as side effects, but a lot of cardiologists use it even though it is an older drug. Let's talk about class 4 antiarrhythmic drugs, okay? These antiarrhythmic drugs block calcium channels, okay, or calcium channel blockers. And we've heard of these quite often. The most common is verapamil, okay, and ditlazam or cardiazam. These are the most common calcium channel blockers. Now, these are more effective against atrial than against ventricular arrhythmias. These work better in atrial arrhythmias. Side effects or common side effects is bradycardia, hypotension, and peripheral edema. Now, after hearing about some of these antiarrhythmics, let's talk about some lab work and some things that we need to watch real quick. So we're using a class 1 antiarrhythmic, which is a sodium channel blocker, okay? It's blocking the sodium from entering the channels. So what is that going to do to your blood work? What is it going to do to your sodium levels? It's blocking some of it from going into the heart, so it's going to increase the sodium in your blood because it's not taking it all out. Okay, so we have to watch sodium levels. We use a potassium channel blocker. What's it going to do to the potassium in your bloodstream? Okay, so we have to monitor potassium on anybody on a class 3 antiarrhythmic. Plus the QT interval. Anybody on a class 3 antiarrhythmic has to have their EKG checked often to watch for the QT interval. If it starts getting too long, I think it's over 4.0, then you have to cut the dose back. Okay. Calcium channel blockers. Interesting case with that. When I was with EMS, we picked up a patient, little case study, that had been given verapamil. Okay. Now, there are a couple other different names for verapamil. All right. Well, on the way, on the back of the ambulance, the nurses at the hospital we were transferring from noted that the patient had received too much. So, if it's a calcium channel blocker, what did we give as an antidote? We gave calcium. Okay. Another medication that we've heard of quite often is magnesium sulfate. Now, the interesting thing, mag sulfate is necessary for transport of sodium, potassium, and calcium across the cell membranes. So it takes care of all of them. It's used to treat arrhythmias. The most common arrhythmia used to treat